Every year, countless seniors head to their doctors for routine checkups, believing they're safeguarding their health. But what if some of these tests could unexpectedly increase your risk of a stroke in just a matter of days? It's a shocking thought, isn't it? You place your trust in your doctor, follow their advice, and assume you're in good hands. Yet, hidden within the complexities of modern medicine are risks that rarely make headlines, not in the media, not in clinic pamphlets, and sometimes not even in conversations with your doctor. Imagine leaving your checkup feeling confident, only to face sudden confusion, weakness, or worse, a stroke, just days later. You're left wondering, how did this happen? The reality is that certain medical tests, especially when overused or performed on seniors with specific health conditions, can quietly trigger complications like blood pressure surges, disrupted circulation, or even a stroke. This video isn't here to frighten you, it's here to arm you with knowledge so you can ask smarter questions and protect yourself and your loved ones. After 60, staying healthy isn't just about catching problems early, it's about avoiding those we might unintentionally create. In the next few minutes, we'll uncover 5 common medical tests that may carry hidden stroke risks for seniors, and more importantly, we'll share how to stay safe before your next visit. If you're over 60, drop a 1 in the comments. If not, drop a 0 and share this with someone who needs to know. Let's dive into the first test you might want to question. The coronary calcium scan, a type of CT scan, checks for calcium buildup in your heart's arteries, often pitched as a proactive way to assess heart disease risk. It sounds like a great idea, right? But for seniors, particularly those with high blood pressure or fragile blood vessels, this test can have unexpected consequences. The scan often uses contrast dye, which can stress your cardiovascular system, potentially causing blood pressure spikes or vessel spasms that increase stroke risk. A 2023 study in the Journal of Cardiovascular Imaging found that seniors over 65 with hypertension faced a 5% high. The dye can also strain kidneys, which are less efficient with age, further complicating blood flow. Consider Robert, a 77-year-old from Oregon, who had a coronary calcium scan as part of a heart health package. He felt fine, but 2 days later, he experienced dizziness and slurred speech, a transient ischemic attack, TIA. His doctors suspected the contrast dye triggered a blood pressure surge, dislodging a small clot. How to protect yourself? Ask your doctor, is this scan necessary? Or can we assess my heart health with a non-contrast test or blood work? Share any history of kidney issues or hypertension, and inquire about alternatives like an echocardiogram. If the scan is essential, ensure your kidney function is tested first. A dobutamine stress echocardiogram uses medication to mimic exercise, testing how your heart responds under stress. It's often recommended for seniors who can't handle a treadmill test. But for those over 60 with heart conditions or vascular issues, the drug can cause rapid heart rate changes or blood pressure spikes, putting strain on fragile blood vessels. A 2021 study in the Journal of the American Heart Association reported that 8% of seniors over 65 experienced complications like arrhythmias or blood pressure surges during dobutamine stress tests. For some, this stress can trigger a stroke, especially if small clots are already present. Lila, a 71-year-old from Illinois, underwent this test after reporting mild fatigue. During the procedure, she felt chest tightness and dizziness. The next day, she suffered a minor stroke, likely due to a blood pressure spike caused by the medication. I thought it was just a routine check, she said later. How to protect yourself? Ask, can we evaluate my heart with a less invasive test, like a resting echocardiogram? If you have no symptoms like chest pain or shortness of breath, question the need for the test. Always share your full medical history, especially heart or vascular issues. Colonoscopies are a standard screening for seniors to detect colon issues, but the sedation used can pose risks, especially for those on blood thinners like warfarin or aspirin. Sedation can cause blood pressure fluctuations, and when combined with medications that affect clotting, it increases the risk of internal bleeding or clots that can travel to the brain. A 2022 study in gastroenterology found that seniors over 65 undergoing sedated colonoscopies had a 3% higher chance of experiencing TIAs within 48 hours, particularly if they were on blood thinners. Emma, a 73-year-old from Georgia, had a routine colonoscopy. 2 days later, she experienced numbness in her face and difficulty speaking, a TIA likely triggered by sedation-related circulatory changes. How to protect yourself? Ask, is this colonoscopy urgent, or can we monitor my health another way, like a stool test? If it's necessary, discuss pausing blood thinners temporarily and explore minimal sedation options. Ensure your doctor knows all your medications. Brain MRIs with contrast are often used to investigate headaches or neurological symptoms, but the gadolinium dye can be risky for seniors with reduced kidney function. After 60, kidneys naturally slow, and undiagnosed kidney issues can prevent the dye from being cleared. leading to gadolinium buildup in the brain or tissues. This can cause neurological symptoms like confusion or dizziness, which mimic stroke warning signs. A 2024 study in the Journal of Neuroimaging found that 6% of seniors over 65 reported stroke-like symptoms, such as balance issues or mental fog, within days of a contrast MRI. Thomas, a 68-year-old from Colorado, had a brain MRI for persistent migraine. Days later, he felt disoriented and unsteady. Tests revealed mild kidney dysfunction, which likely caused gadolinium retention. How to protect yourself: request a kidney function test, GFR, before a contrast MRI. Ask, can we do this without contrast, or is there another test like a CT or ultrasound? Disclose any past reactions to imaging dyes or kidney issues. This non-invasive test checks blood flow in the legs or arms, often recommended to screen for peripheral artery disease. While it seems harmless, finding minor narrowing can lead to unnecessary procedures like angioplasty or stenting, which carry stroke risks in seniors with vascular issues. These procedures can dislodge clots or cause blood pressure changes. A 2023 study in vascular medicine showed that seniors with asymptomatic artery narrowing who underwent invasive procedures after a Doppler ultrasound had a 4% risk of stroke during or soon after. Clara, an 80-year-old from Virginia, had a Doppler ultrasound during a routine checkup. It showed mild narrowing, leading to a stent procedure. During recovery, she suffered a minor stroke, likely from a dislodged clot. How to protect yourself: if you have no symptoms like leg pain or cramping, ask, why do we need this test? What will we do if we find something? If narrowing is detected, explore medication or lifestyle changes before procedures, and always seek a second opinion. Not every test is dangerous, but not every test is essential, especially after 60. Your body reacts differently as you age, and routine procedures like contrast dyes, sedation, or stress tests can have unexpected consequences. A simple scan or injection could destabilize your system if it's already vulnerable. That's why it's crucial to pause, ask questions, and ensure every test aligns with your specific health needs, not just a standard protocol. You have the right to ask, is this test necessary? Are there safer alternatives? Informed choices lead to better health and peace of mind. Your health matters, and your voice is powerful. If you or a loved one have ever felt off after a medical test, drop a 1 in the comment. If not, drop a 0. Let's connect, share, and learn together. For more insights to keep you empowered, subscribe to Healthy Living Today, where we dig deep into the truths that matter to your well-being.